Run Africa, in collaboration with Run Africa Solutions in Kenya, in partnership of Kenya Aid, supports the running of healthcare programs in Shikunga village through Murudef Community Health Center, which was established in 2003 with the support of Dr. Ryan Smith, an Austrian-based emergency doctor, and the local community. Built on the principles of basic healthcare, Murudef Community Health Center offers services in maternal child care, HIV/AIDS, malaria, preventive, curative care, and ambulance services to those in need of emergency care support, and several medical camp booths on specialized areas and on general health care to support both the community and the general public. Murudef Community Health Center has been able to offer free eye checkup for the second year this time round, where locals here keep benefiting with free eye operations, free eye glasses, and medicine. According to Onesmus Mercy, the founder of Run Africa Solutions, the area has witnessed a lot of eye-related cases, which prompted the need to seek support from friends under Dr. Ryan Smith.
I think poverty is a major dynamic of this area. Many people can't afford a meal in a day, and taking money to spend on healthcare when they can't afford a meal becomes a big challenge. So most people will prefer to even just stay without even seeing, but to get something to eat.
Daria Fena is a clinical officer at the facility, and she says the first eye camp was very insightful and was an eye-opener that showed how the high number of locals were suffering silently in pain.
When the first camp came, it really had an impact. We did not know how much people were suffering out here because of eye problems. And the first camp was an eye-opener for us. In our catchment population, the first camp served over 100 people with cataract surgeries, about 70 on day one. Some of them came back to say thank you. Some of them even brought us chicken as thank you, because you find someone had lived years without seeing, and with the surgery they're able to see. We had good success stories. From the first camp up to now, we've had clients coming asking for the service, but because we are not able to offer that, we don't have the right equipment for eye services, they have had to wait all this time until now, this second camp.
Dr. Leyan Asempele, an ophthalmologist, says most patients present with cataracts, and old age is the greatest contributor, with other related diseases like diabetes.
A lot of them are coming in, as I've mentioned, different eye ailments. A lot of these people are also coming with allergies. I found a lot of them with allergies. We also have high eye pressures, which is quite common, not only in this particular location, but generally on elderly patients. But our major problem here is cataracts, and cataracts is from old age. I know tomorrow we've actually admitted so far 3 patients with bilateral cataracts this morning. Out of the 50 we did were people who came in for their second eyes, but there are 3 who will be able to have benefit from surgeries on both sides.
Dr. Sempele says this free medical camp has been very beneficial to the community, since most of them come from vulnerable backgrounds.
These services will not have been possible without your support, you friends out there. And as we are looking at, what you're looking at is we're targeting about 150 eye ailments, especially cataracts, like we will do 150 cataracts. So far we have done 50. We have been on the ground for the last 4 days, mobilization started, and of course now pre-screening of the patients to identify those cases that would require surgeries. And the experience, it's been wonderful. It's not a very easy terrain. I've noticed that a lot of these patients would use public transport to get to us, and which is not cheap. And as I've mentioned, that is really a lot of help, because there is that cost. Of course, there's also cost of the medication. It's not very easy. The nearest hospital, I think, is about 50 kilometers here.
He, however, says there is need for more equipment and personnel for the facility.
So our major problem here, of course, as you can see that the hospital is young, is still growing. There is so much that needs to be put in. Of course, we are looking at human resource. As I've said, it is a community hospital. The cost of having people or employment here is not very cheap. Employing specialists like us to have somebody on the ground.
Sentiments that Clinical Officer Fena echoes.
Not have, like, we cannot do even a simple optometry here. We don't have that equipment. And also the staffing. We're not in a position to employ a staff that is specifically trained in ophthalmology as at now. Yeah.
Alfaya Baraza was visually impaired for 8 years, but when he benefited with operation during the first free medical camp, is now able to see.
Kanipasua macho na niliungua zaidi ya miaka 8. Lakini saa hizi naona, natembea. Naona hata watoto sikuwa nawajua. Kwa nasikia tu kwa sauti mtoto. Lakini wakati walitoa pendiki, akanionyesha ni nani, sasa ikakuwa kama ni sinema. Kwa sasa sikuwa najua mtu. Hasa mtoto yangu kijana nikampata, bila alicheka nikakumbuka huyu ni mtoto yangu. Nikapata hata na mandefu. Alikuwa mtoto. Kwa hiyo mimi nashukuru Mungu. Natembea naona. Tena nimerudi kwa hiyo hospitali kuona madaktari kupeana ujumbe, asante sana.
For these residents, the only hope remains any free medical camp that is conducted by Murudef, since they have to choose between buying food or seeking healthcare services.
Our high appreciation goes to Kenya Aid team, which mobilized friends and supporters in Australia to put up together funds to support this medical camp. And we are appealing for them to continue doing the same so that we can continue helping more people.
Just as Baraza was able to receive his eyesight, they remain hopeful that the health facility will always be their time savior.